Assalamu alaikum. Welcome to my channel. My name is Shafiq and I'm an orthotist. Today I would like to make a video for a very common topic which is known as drop foot or foot drop. So I would like to discuss a little bit about the causes of the foot drop and what are the possible solutions for the treatment. So I would like to discuss first what is the foot drop. Actually, foot drop is a symptom, is a condition of underlying some neuromuscular problem. So in drop foot, what happens? The patient is unable to lift the forefoot or the foot. The patient has no any ability to lift or dorsiflex the foot. It can be unilateral, it can be bilateral. So the problem will be for patient, he will be suffering during walking, he will be unable to dorsiflex the foot or the toes, and in common term, he is unable to lift the foot. This is the simple definition of the drop foot, or also known as foot drop. Okay, the next step, what are the causes of the drop foot? So there are many causes and the treatment will be consist as per the cause. So anything which will damage the common peroneal nerve which leads to a drop foot. So the first cause can be a direct injury to the nerve. So nerve injury is the first cause. It can be direct injury to a common peroneal nerve or any injury above that level. Okay, in the sciatic nerve or even in the spinal disorders. So any injury which leads to the damage of the nerves and that will cause drop foot. The second condition can be a muscular damage or muscle weakness. Any injury to the muscles or any disease to the muscles which causes muscle itself weak. So that can be a muscular dystrophy, any other problem leading to disease or leading to the weakness of that muscles group. And the third one can be a spinal or spinal disorders, okay, brain or spinal disorders. That includes many diseases as spina bifida, as polio, CP, other multiple sclerosis, and any other disease which leads to damage in the spine, in the brain, or anywhere in the body, the injury to the nerve. Okay, so how we can diagnose this and what are the treatment options available? The first thing, when the patient will experience any injury or any other, if not injury or any other disease, and he is unable to lift the forefoot. So there will be a physical test, there can be an X-ray, MRI and many other things from the doctor's point of view. So they can check where is the problem, where is the injury, is it the nerve, muscles or whatever. So any patient which he is unable to take the forefoot up, that will be a drop foot. So now the drop foot can be a permanent drop foot or it can be recoverable. So depends on the cause and the injury of the nerve. So in case if it is only compression or a small injury which can be corrected by surgical intervention or through physical therapy or with the time. So the treatment option will be medication, physical therapy and orthotic management or even surgical intervention. So physical therapy will be, they will try to stabilize the foot, ankle, and they will try to enhance the power of the muscles. They will try to, they will increase the power of the muscles group and they will try to maintain it in a normal position. The second option will be in orthotic management. So in orthotics, I'll show you some orthotics which can be used for the treatment options. So the first one which is called as a drop foot orthosis. It is a off-the-shelf orthosis. It is a ready-made one. It is available in the market and different sizes. small, medium, large, extra large, as per the requirement of the feet. So if you will see in the picture here, you can see that this brace is made a 90 degree. If you see the foot and ankle, it's 90 degree. So this will help in keeping the foot in neutral position. So what are the common problems for the patient who has drop foot? Number one, the patient with the drop foot, whenever he will start gait, even from the gait pattern from the start and on the initial contact, when the heel strike, we need the foot and ankle should be at 90 degree, at neutral position. So due to the paralysis of the front muscles of the foot, the foot will drop. Okay, the interior compartment muscles, tibialis anterior. So these muscles, because these are paralyzed, the foot will go in drop position without the brace. And when the patient will start walking, first of all he has to use his knee muscles and hip muscles. He will use exaggeration, he will excess knee flexion and hip flexion. The patient will do more knee and hip flexion to clear the ground. Because if he will walk in the same pattern, the toe area of the foot, it will be dragged with the ground. And second, you will see that a typical foot drop pattern, that's called foot slap. If the patient will walk with the foot drop, the front portion of the foot, it will, due to the paralysis of the muscles, it will be not in controlled position. So while walking, the foot will slap to the ground. You will see the typical steppage foot gait pattern or a slap foot. To prevent that, we need to make some braces. There are many options as per the requirement, as per the patient's condition. For the normal flat foot, or we can use the drop foot splint. It's called as drop foot splint. So it will prevent the foot drop during gait pattern. But this will only be described to a typical flat foot, a normal flat foot patient who has no any complication and who has and the patient is not a spastic one, is a normal flaccid drop foot condition. So this will be an ideal brace. This will help in lifting the foot and keeping the foot through all the gait pattern in the neutral and desired position. So it will give more energy. So the patient will have no fatigue, he will not tired, he will not use more his knees and hip muscles to clear the ground and to walk. Okay, I will show you another one for another condition. Now we have another design which is also made for drop foot patients. But if you notice here, we have articulated AFO, we have a joint here. So if you see here, this is also 90 degree, and when I flex this one, we can get a more 45 degree of dorsiflexion, and there is a stop here, but the plantar flexion is stop. So this will also help during gait with the same pattern of the foot controlled movement and dorsiflexion assist. For this patient, we have to use this brace, this specific brace with the joint, dorsiflexion assist and plantar stop for a patient who has mediolateral instability. The patient there are conditions that a patient who has drop foot along with mediolateral instability. So in that patient, we cannot give a normal drop foot splint because the patient has unstable ankle. So for the stability of ankle, we can cover the malleoli. Okay, we can cover the malleoli with the special rigid design, but we can make a joint inside. So this will help as a dorsiflexor, helping dorsiflexion, and at the same time it will prevent any mediolateral movement of the ankle. So this will help in keeping the foot in neutral position, mediolateral stability and dorsiflexion assist. This is a typical joint. This one is a custom made. We cannot get this off the shelf or the ready made. This custom made, we need to have the patient assessment, we need to take the costing, measurements, fabrication, fitting, trial fitting, everything, and then we need to see the patient gait pattern. So this one is a customized for separate for each patient. It cannot be used for any other, and it's not available like in sizes. Okay, now I will show you another design. If you can see here, now I have another design which is called carbon fiber AFO or TOF brace. The function of the brace is the same. We have the dorsiflexion assistance and we have dorsiflexion, there's no any plantar flexion. It's plantar flexion stop and dorsiflexion assist. The material is carbon fiber. This is much lighter and a low profile one, and it can be easily adjusted in any shoes. This can also be used for normal drop foot patients without any spasticity or without any medial lateral instability. Okay, kindly have a look on the screen. We have some pictures there which can also be used and other alternate options for the drop foot. So I have discussed already the orthotic point of view. Even if there are some conditions that maybe it's a permanent one and the patient has to use this for whole life, or if it is the reversible drop foot and the injury is recovered and patient he can leave that one after when he is able to walk normally, so there will be no use of the orthotics. And in some cases there are surgeries recommended to relieve the pressure on the nerve, or in some cases it will be in ankylosis, the fixation of the joints in a neutral position, so the patient will walk in a neutral way, but the disadvantage will be because the patient will lost most of the movements, the natural movements. So these was only some few points from orthotic points of view regarding the drop foot. So if you got some points from me, and if you like my video, kindly subscribe my channel and the bell icon that you will not miss any other video which I will upload later on. And thank you for visiting my channel. Bye bye.